healthcare reform is a major step forward. It is true that probably the biggest piece of expansion, the Medicaid expansion, which guarantees all people at or below 133% of poverty access to Medicaid, eliminates the requirement that a person in the context of HIV be disabled before being eligible for Medicaid, does not go into effect until 2014. Some of the Medicare Part D changes that reduce the out-of-pocket costs go into effect immediately and are phased in between now and 2020. In terms of the private insurance reforms, eliminating the ability to charge more for a person based on health status, most of that does not go into effect until 2014 either.
So there's a long wait for folks.
There's a long wait for folks. I mean, the big thing that we're working on right now certainly is to try to create a bridge to 2014. That bridge must include full funding of the Ryan White program, particularly emergency ADAP funding needs to be enacted immediately. As most people know, we're in the middle of May here. We have about 1,000 people on ADAP waiting lists, but it also needs to include passage of the Early Treatment for HIV Act, or ETHA, which will give states the option to extend the Medicaid program, expand it to people living with HIV and AIDS immediately, as opposed to waiting till 2014.